Dr. Jaffe, can you please shed some light on what drives the emergence of a cytokine storm and eventual acute respiratory distress syndrome in some patients, but not others? Can we influence this process?
Well, cytokine storm is something that immunologists like myself have been studying, seeking to understand, to look deeply at for decades. Although I must tell you that in the last few weeks, it's gotten into the general conversation, and I mean on the media, social media, and journalists. But what is it? What is a cytokine storm? What it means is your immune system gets activated by being overwhelmed by more foreign invaders than it can recycle. Now, we have 50 billion surveillance cells. So our innate immune defense and repair system starts with 50 billion cells that when they are adequately nourished, when they have enough ascorbate and polyphenolics and magnesium and the essentials that they need, each one of those little cells can take in 50 organisms, 50 foreign invaders, 50 viruses. Well, 50 billion times 50 is 2.5 trillion. So when you are healthy, you have an invisible surveillance force of billions of cells able to deal with trillions of foreign invaders, whether they come in through the air or the skin, whether they come in through the food or however they get to you. Your immune defense and repair system is designed to take them in, put them in the lysosomal recycling center, break them down to elemental building blocks, and use them to build you up. On the other hand, what happens when you don't have enough ascorbate, when you're not doing a C-cleanse on a regular basis, when you don't have enough magnesium because you're not gating your magnesium choline citrate intake based on your morning urine pH? What happens if you don't keep your urine sunshine yellow based on the Lifeguard capsules? Well, now those 50 billion cells just sit around waiting to be re-energized. Once you take in enough ascorbate and other essential nutrients, they wake back up. But if they get low in energy, they just lay down, they don't wiggle, and they do their best to survive. So it turns out to be very important whether you're in the healthy pH range based on morning urine, 6.5 to 7.5, indicative of minerals, especially magnesium, and you want to enhance that magnesium with choline citrate, something we've pioneered and documented. So when you give the body what it needs, you have ample defense and you can repair, really almost in the background. The body is so remarkable that when we're healthy, it really doesn't pay us much. It doesn't call us to attention. It's when we are unwell, it's when we lack something essential. That's when the body says, oh, I'm going to give you a sign that we need more of the essential nutrients. It could be an ache. It could be a lack of restorative sleep. It could be a lack of flexibility. It could be a lack of endurance or concentration. It could be something that happens regularly after we eat because our immune defense and repair system is not being adequately recognized. We have delayed food chemical reactions on a regular basis because of the choices we make of what we eat and drink, think, and do. So we want to rehabilitate, for most people, their digestive, respiratory, and skin tolerance, resilience, repair ability. And we do that by getting the good stuff in and the bad stuff out.